Rolling.
Dr. Paul here. We have got a young lady with quite an impressive throat. Let's take a look.
Start that one more time.
Dr. Paul here. We've got a young lady with quite an impressive throat. Let's go take a look.
Perfect.
Hello. Hi. How you guys doing? You've had a sore throat.
Yes.
Okay. And before yesterday you were totally fine?
Yeah.
Okay.
It happened overnight.
Overnight, just bam. For the viewers, I've already done a complete exam. We're just going to focus in on the throat for you because that's really what was somewhat impressive. So we'll take a look. So what we're seeing is very red. Tonsils are about size 2+, almost touching the uvula, which is the little thing that's hanging down from the back there. And you kind of see a spottedness on the palate, on the roof of the mouth, back towards the tonsils. There's some little dots. Some might call that palatal petechiae. And that's, when you see that, folks, that's strep. I mean, I always do swab the throat, which we've already done. We won't have to do that again. Phew. So we've already swabbed the throat and it came back positive right away. So this is a definite case of strep throat. And we've already talked about how you're not allergic to antibiotics. So we're going to get you on some amoxicillin. You'll start feeling better in 18 to 24 hours. That'll be good, right?
Yeah, yeah, she's excited about that part.
Right, so that'll be good. And then a new toothbrush in a few days, because sometimes, you know, you've been brushing your teeth and there's strep on that brush. We don't want you to reinfect yourself. And then actually, I'm interested in, would you be willing to share your strep story?
Sure.
Okay.
So one of the reasons why we ran in right away and why I always treat strep is because when I was 21, I developed strep and didn't treat it.
Yeah.
I thought maybe, you know, my body could beat it.
There you go. There you go.
And I spiked an incredibly high fever and got dehydrated, had joint pain. Ever since then, I've had heart trouble, you know, palpitations and such.
Interesting.
And mitral valve prolapse.
Wow. So for viewers, I have actually had this discussion with one of my naturopathic friends who I really respect, but she was saying, well, you don't always have to treat strep. Well, Mom's description here of what happened is probably endocarditis, and for those of you who are students, this is always a board question, like, what are the signs of endocarditis? Well, you started to describe them. Look them up if you're studying for your boards. But here's one of the reasons we treat strep throat, and thank you so much for sharing.
Sure.
That was very helpful. You had a very impressive throat, and Mom, you had a wonderful story that explains why we should treat strep throat. So do you have anything you want to tell your fans on YouTube? Not a fan of strep throat. I had it once when I was in.
Fun.
It is not fun. And when I had mine, I was in medical school, and it felt like I was swallowing razor blades. Like you were saying, it really hurts to swallow. Yeah. It can really hurt to swallow. The good thing is with this, when you treat it, you're better in a day. Thanks for watching. I'm Dr. Paul.